So what happens after you fall asleep with general anesthesia? The first thing we do is we have you breathe oxygen through a face mask so that your lungs are as full of oxygen as possible before you go off to sleep. Secondly, we give IV medications to drift you off to sleep. Then after you're asleep, we tape your eyes shut to prevent corneal abrasions or scratches over your eye. We continue to breathe for you, and we give you paralytic medications through your IV to optimize conditions for placement of the breathing tube. Then we use either a laryngoscope or a video laryngoscope to visualize your vocal cords. We then place an appropriately sized endotracheal tube or breathing tube or a laryngeal mask airway to maintain adequate ventilation and oxygenation during surgery. Then to maintain the anesthesia, we either use volatile anesthetics or gases, anesthesia gases, or we maintain the anesthesia with something called TIVA or total IV anesthesia, which is where you're kept asleep with IV medications only. What are the most common side effects after anesthesia? Just like anything can happen when you drive a car, anything can happen while you're under anesthesia, but there are certain things that are very common and there are certain things that are not very common. The most common is sleepiness, fatigue, drowsiness, brain fog. You may not remember a lot of the events that happened around anesthesia time because we give you a cocktail of medications that affect your memory. These effects are usually short-lived and wear off as the anesthesia starts to clear out of your system. Unfortunately, something common is postoperative nausea and vomiting. And there are certain risk factors that make you more susceptible to having postoperative nausea and vomiting. Females, non-smokers, if you are receiving opiate medications during the surgical period, and if you have a history of postoperative nausea and vomiting, motion sickness, and there's also certain surgical procedures that have a higher rate of nausea and vomiting compared to others. There's also some other risk factors such as the length of the surgical procedure. So if you're under anesthesia for a very long time, then you're more likely to develop nausea and vomiting compared to if you are just having a very short procedure. Also possible are muscle aches from medications that we give you, shivering, especially if certain medications are used, fatigue, and then some things that are not very likely to happen but are possible are allergic reactions, aspiration, which is where the contents of your stomach can come up into your airway and into your lungs and affect your breathing and your oxygenation. Awareness under anesthesia is exceedingly uncommon, especially for elective procedures. Healthy patients, routine procedures, it's not very likely at all to occur.